Medication administration and injections. What is an intramuscular injection? Medication is injected directly into the muscle. What are the sites of intramuscular injections? Deltoid muscle of the arm, this is most common for vaccines. Vastus lateralis, muscle of the thigh. Ventrogluteal, muscle of the hip. Dorsal gluteal, muscles of the buttocks, and rectus femoris. What type of solution is normal saline? It's a 0.9% sodium chloride in water crystalloid solution, and it is isotonic. What are the uses for normal saline? It increases circulating personal volume when red cells are adequate, replaces losses without altering fluid concentrations, and it is helpful for sodium replacement. What type of solution is half normal saline? 0.45% sodium chloride in water crystalloid solution, and this is hypotonic. What are the uses for half normal saline? It raises total fluid volume. It's useful for daily maintenance of body fluids, but it is of less value for replacement of sodium chloride deficit. It's helpful for establishing renal function, and it is a fluid replacement for clients who don't need extra glucose. These are your diabetics. What type of solution is lactated Ringer's LR? It is normal saline with electrolytes and buffer, and this is isotonic. What are the uses for lactated Ringer's? It replaces fluid and buffers pH. It is normal saline with potassium, calcium, and lactate buffer, and it is often seen with surgery. What type of solution is D5W? It's dextrose 5% in a water crystalloid solution. It's isotonic in the bag, but physiologically hypotonic. What are the uses for D5W? It raises total blood volume. It's helpful in rehydrating and excretory purposes. It provides 170 to 200 calories for energy, and it is physiologically hypotonic because the dextrose is metabolized quickly so that only water remains, and that's a hypotonic fluid. What type of solution is D5 normal saline? Dextrose 5% and 0.9% normal saline. This is hypertonic. What are the uses for D5 normal saline? It replaces fluid sodium, chloride, and calories. You need to watch for fluid volume overload. What type of solution is D5 half normal saline? It's dextrose 5% and 0.45% normal saline, and it is hypertonic. What are the uses for D5 half normal saline? It's useful for daily maintenance of body fluids and nutrition, and for rehydration. It's a most common postoperative fluid. What type of solution is D5LR? It is dextrose 5% in lactated Ringer's, and it is hypertonic. What are the uses for D5LR? They're the same as the lactated ringer, so they replace fluid and buffers the pH. It also provides about 180 calories per liter, and you need to also watch for fluid volume overload. What type of solution is Normal-Sol R? It is Normal-Sol, and this is isotonic. What are the uses for Normal-Sol R? They replace fluid and buffers the pH of 7.4. It contains sodium, chloride, calcium, potassium, and magnesium, and this is a common fluid for OR and PACU, the post-anesthesia care unit. What are veins of the forearm? Basilic, medial, antebrachial, cephalic, median cubital, accessory cephalic, and radial. What are veins of the hand? Cephalic, basilic, dorsal venous network, and the dorsal metacarpal veins. What are veins of the foot? Great saphenous, dorsal plexus, and dorsal arch. What are landmarks of the deltoid muscle? The acromial process. What are landmarks of the vastus lateralis and rectus femoris? The greater trochanter of the femur. What are landmarks of the dorsal gluteal muscle? The posterior superior iliac spine. What are landmarks of the ventrogluteal muscle? The iliac crest, anterior superior iliac spine, and greater trochanter of the femur. What are the three types of injection sites? ID, intradermal, SC, subcutaneous, and IM, intramuscular. What needle angle is used for intradermal injections? 10 to 15 or 5 to 15? What needle angle is used for subcutaneous injections? 45 to 90 degrees or 40 to 90 degrees? What needle angle is used for intramuscular injections? 90 degrees. What are three sites for intradermal injections? The inner forearm, chest, or back. These areas are lightly pigmented, lesion-free, relatively hairless, and commonly the ventral forearm. What are three sites for subcutaneous injections? Fatty areas including the outer upper arm, the backs of arms, the anterior thigh, or abdomen. What are three sites for intramuscular injections? Gluteus, ventral gluteal, thigh, vastus lateralis, and deltoid. What gauge and length needle is appropriate for intradermal injections? 27 to 30 gauge, 1/4 to 3/8 of an inch, or 25 to 28 gauge, 1/4 to 5/8 inch. What gauge and length needle is appropriate for subcutaneous injections? 25 to 28 gauge, 5/8 of an inch, or 25 to 27 gauge, 1/4 to 5/8 inch. What gauge and length needle is appropriate for intramuscular injections? 23 gauge, 1 to 1.5 inches, or 21 to 25 gauge, 1 to 3 inches. What volume is appropriate for an intradermal injection? 0.1 to 0.2 milliliters. What volume is appropriate for a subcutaneous injection? 0.5 to 1 milliliters. What volume is appropriate for an intramuscular injection? Less than or equal to 3 mLs, or less than or equal to 1 ml for deltoid small muscles. What is the technique for intradermal and subcutaneous injections? Insert, aspirate, inject, withdraw, and massage. When do you not aspirate or massage the site? If giving heparin and Lovenox subcutaneous shots with a 25 to 26 gauge needle at a 90-degree angle or 45-degree angle for a thin patient. What is the injection technique for an intravenous injection? 25-degree angle. What is the maximum injection volume in adult patients for deltoid injections? 0.5 to 2 milliliters. What is the maximum injection volume in adult patients for dorsal gluteal injections? 4 milliliters. What is the maximum injection volume in adult patients for ventral gluteal injections? 2.5 to 5 milliliters. What is the maximum injection volume in adult patients for rectus femoris injections? 5 milliliters. What is the maximum injection volume in adult patients for vastus lateralis injections? 5 milliliters. What are advantages of the deltoid injection site? It's easily accessible and the patient only exposes their arm. What are advantages of the ventral gluteal injection site? It's free of nerves and blood vessels, and it's a narrower layer of fat of consistent with thickness compared with dorsal gluteal. What are advantages of the rectus femoris injection site? It can be used when other sites are contraindicated and the patient can self-inject. What are advantages of the vastus lateralis injection site? It's easily accessible and there's no major blood vessels or nerve structures. What are disadvantages of the deltoid injection site? The number and volume of injections are limited because of small injection site area. What are disadvantages of the dorsal gluteal injection site? There's major nerve and blood vessels present, it's slow absorption, and there's a thick layer of adipose tissue. What are disadvantages of the rectus femoris injection site? There's discomfort with injection. What is the onset of subcutaneous medication? 20 to 30 minutes. What is the onset of intramuscular medication? 10 to 20 minutes. What is the onset of intradermal medication? Immediately.